Hey friends, I'm Diane of Early to Bed, Early to Rise, and I'm a physician assistant. And I'd love to share with you some things from integrative medicine and holistic health about your thyroid, because if your thyroid ain't happy, ain't nobody happy. So the thyroid is a small butterfly-shaped gland that lives right here in your neck. It produces a variety of different hormones that control a lot of really great things, like your metabolism, so gaining or losing weight, energy levels, sometimes hair loss, particularly the lateral third of the eyebrows, as well as it can play a role in core body temperature, like your resting body temperature, and if you feel hotter or colder than everybody else in the room. Things like mental clarity, being able to think clearly through different things, and even like muscle tone and strength. So a lot of great things, and we'll get into all those symptoms in a little bit. But first, want to talk about what the thyroid makes. The thyroid makes 4 different thyroid hormones and then a few other things too. So the thyroid makes T1, T2, T3, and T4, pretty easy to remember. T1 and 2 play a role in energy and metabolism. We don't seem to have a great grasp medically on exactly what they do. So those are not ones that are typically tested and looked at in both conventional medicine or in holistic health. They're just not real helpful for us yet, but they are helpful for your body. Your big player is T3. That is the most active form of thyroid hormone. If you have a lot or not enough of T3, you will feel it in terms of energy, metabolism, weight loss or gain, lots of different things. And T4 is the final of the main thyroid hormones. T4 is the inactive version. T4 is converted to T3 to be more active. It does a little bit on its own, but T3 is your particularly active one. That'll come into play later. If you make too much T4, the body will store it as reverse T3. That number goes up with a lot of different things, particularly times of stress, including long-term illnesses or other things that would affect your HPA axis and your adrenal glands. So check out that video if you want to see more. But a high reverse T3 level typically means you have been under stress for quite a period of time and your body is having a little trouble functioning. So wanted to throw that out there. Reverse T3 is also what what bears use to hibernate in the winter. So if your reverse T3 level is up, you tend to have trouble having energy to get up and get going in the morning and usually losing weight. If you have been on a low carb diet for an extended period of time, keto, Atkins, anything along those lines, your reverse T3 tends to go up. So it can make it harder for you to maintain the healthy weight and skinny jeans you want to be at and in for a long period of time. So other thyroid players are your TSH, thyroid stimulating hormone, comes from the pituitary gland in the brain, talks to the thyroid and says, make more thyroid hormones, or whoa, slow it down. So TSH goes up when the body says make more thyroid hormones. It's just more hormones circulating around telling the thyroid, make more. TSH goes down when you have too many circulating thyroid hormones. So someone with hyperthyroidism or Graves' disease, a type of hyperthyroidism where your eyes start to bug out a little bit, you have a low TSH because you are making way too many thyroid hormones. So 2 other important players are thyroglobulin, which is a part of every of the thyroid hormones, T1 through T4, and also so it's considered like a precursor to making those building blocks to help you make them. It also plays a role in converting T4, that less active form, to T3, the more active form. Thyroid peroxidase is another one that you should know. It also plays a very big role in converting that inactive T4 to more active T3. So those will come up back up again. You don't have to memorize them. Just wanted you to know. So symptoms that your thyroid is not working like it should. Temperature intolerance. You are hotter or colder than everybody else in the room. Hotter usually being overactive thyroid, colder usually being underactive thyroid. a lot of things I have seen in my patients are people who tell me, oh, I have a fever, my temperature is 99. And usually my core body temperature is 96 or 97. That typically means that your thyroid is not functioning optimally or as well as it could. So while that may be true for you, that 99 is higher than your normal, you might want to think about doing some of these things naturally to help your thyroid work at its very best so you can feel your very best. So tuck that little bit away in your memory and keep that for later. So as we've touched on before, other symptoms of thyroid problems are difficulty gaining or losing weight, hyperactive thyroid, trouble gaining weight. Usually you lose a good bit of weight and your heart rate goes up a good bit. Much more common to see weight gain with an underactive thyroid and trouble losing that weight gain. So hair loss, usually scalp hair is what we see, and then that lateral third of the eyebrows for women. Fatigue, loss of energy, low muscle tone, feeling sluggish. Depression is not uncommon to go with that. Pale face, kind of puffiness to the face. We call it moon faces in medical terminology. Cankles, those ankles that kind of blend into your calves. Particularly, that's one that I've noticed in teens and preteens and younger kids. It tends to be an indication that we should check the thyroid and make sure it's working like it should. Sometimes you'll also notice a yellowness to the soles of your feet, and particularly your heels. That can also be an indicator of suboptimal thyroid functioning. Constipation or diarrhea. Constipation being more along the lines of low thyroid function, diarrhea more with hyperactive thyroid, difficulty concentrating, brain fog. It can even, in like terrible scenarios, end up in a coma, but in 10 years of emergency medicine, have never seen that. Just throwing it out there as a possibility. Difficulty conceiving a child and irregular menstrual cycle can be related to abnormal thyroid function. So joint pain, muscle pain, cramps, decreased sweating, and dry skin. Typically that one goes along with the low thyroid. Sweating would be more like excess sweating can be hyperthyroidism, or working more than it should. Peripheral neuropathy, numbness, tingling in your hands and your feet. So sometimes sleep apnea, excessive daytime sleepiness, and secondary insomnia can all go along with your thyroid not functioning like it should. Secondary insomnia is when you wake up in the middle of the night and can't go back to sleep no matter what you do, and that happening frequently. Thickened nails that are brittle and have deep ridges in them can also indicate that the thyroid's not working like it should. Lowered heart rate would be an indication of suboptimal thyroid functioning, not working as well as it should. Also, diastolic hypertension, which is high blood pressure on your bottom number. If you're 120 over 80, if that lower number 80 were to go up above 90, that can be an indication of your thyroid not working like it should. If you stick your tongue out in the mirror and notice that it seems a little swollen, that you're noticing some imprints of your teeth, that can be food allergies or also your thyroid not working like it should. And sometimes slurred speech can be an indication of that. Also, if you notice you have elevated cholesterol on your general labs and anemia or low blood counts, particularly pernicious anemia, can go along with some other stuff. That's B12 deficiency related anemia. Both of those can be indications of thyroid dysfunction. So I've already kind of hinted at this, but hypothyroidism is low thyroid function. You are not making as many thyroid hormones as you should. Hyperthyroidism, too much thyroid hormone. Your thyroid is hyperactive, you have too many thyroid hormones. Both of those you should be seeing a medical provider and having that regulated, particularly high thyroid function. So it's very, very important that you get that treated and taken care of. There's another version of thyroid problems called thyroiditis, inflammation of the thyroid itself. Hashimoto's thyroiditis, which is an autoimmune condition where your body attacks its own thyroid, is incredibly common these days. It is the leading cause of low thyroid function or hypothyroidism in America in people over the age of 6. So it's everywhere. You need to check thyroid peroxidase antibodies and antithyroglobulin antibodies in the blood to see if that's one of the things that you have. But it is incredibly common. So I just wanted to throw that out there. Most doctors are checking for that now. That's been a big shift in medicine in the last 12 to 13 years, but not everybody. So that would be worth asking for, or checking with Everlywell, which is a lot cheaper than the integrative medicine office I've worked in. So anyways, just something to think about. So people with autoimmune thyroid conditions or thyroiditis are at a higher likelihood to have other autoimmune conditions like pernicious anemia, adrenal insufficiency, celiac disease, type 1 diabetes, so there can be a link there. And with a thyroiditis, sometimes you will get symptoms of too much thyroid hormone and then symptoms of low thyroid hormone. What happens is when the body is attacking that thyroid, you will get bursts of extra thyroid activity, and then it will die back down and you won't have enough. Ultimately, what happens is your thyroid tends to burn itself out and you just don't make enough hormones anymore and end up hypothyroid. In the conventional medical community, a lot of times we just wait it out and till you get to the point of hypothyroidism where you don't make enough, and then we just give you a supplement. We give you a medication to treat that. So it's one of those conundrums in conventional medicine. We've got some things that may be helpful, and I have had patients in the integrative medicine office heal up their thyroid antibodies. No more thyroid antibodies. So if you have found on that list of symptoms you resonate with some of the too high thyroid hormones and the too low thyroid hormones, you should get your thyroid antibodies checked. You very likely have Hashimoto's thyroiditis, or it's a strong possibility. You should look into that. So causes of thyroid disorders. Why is this happening to like everybody? So autoimmune diseases, there's that big link between other autoimmune diseases and Hashimoto's, where your immune system is just going a little bit crazy. Check out the environmental toxins lecture, as well as leaky gut, lots of different things going on. So other things that can affect the thyroid: leaky gut, HPA axis dysregulation, that's also sometimes called adrenal fatigue, food allergies, nutrient deficiencies, pregnancy and postpartum. Those crazy reproductive hormones that allowed you to have a baby also can affect that thyroid. There's a lot of interplay between the two. So that pregnancy period, as well as that first 12 months after you've had a baby, those are not uncommon times for weird thyroid fluctuations. Doesn't always mean you have Hashimoto's, doesn't always mean that you're hypothyroid, but that is a weird time. So just wanted to throw that out there. As far as nutrient deficiencies go, the standard American diet, the SAD diet, has a lot lacking in its nutrients these days, and one of them is iodine. Table salt had iodine put into it decades ago when we realized people had goiters, and iodine is a building block for healthy thyroid hormones. So they put iodine in the salt, and that helped a lot. These days, iodine is in competition with a lot of other things in our food supply. Flour is brominated. There's bromide put into it to help with its shelf life. Bromide, fluoride, chloride, if you remember your old periodic table, they're all in the same column in the periodic table. They compete with one another, and iodine is last man out. It doesn't win when it competes with the bromide in the flour. There's fluoride and chloride in your water, or chloride in your cleaning supplies, things like that. So that competition there means iodine can get bumped. And then in recent years, there has been a trend toward mineral salts or sea salt, Himalayan salt in use because it's healthier. And there's lots of great things about that. But there is very low iodine in most mineral salts. The Himalayan salt depends on the region where it's grown and how much rainfall it has as to its iodine content. Sea salt, ironically, is not a great source usually for iodine. Iodine is found at the bottom of the sea, in your kelp, in your seaweed, and your seafood, but not so much in the sea salt that's harvested. So just something to keep in mind, that could be one of the underlying factors in why people are developing thyroid issues these days. So lab work that you need to check your thyroid, we've kind of already hit all the thyroid hormones, but I'll repeat them again. You want T3 free and total, T4 free and total, TSH, antithyroglobulin antibodies, anti-thyroid peroxidase antibodies. So those are your big thyroid ones that you want. 10 to 15% of people are, in theory, seronegative, so you won't actually have those antibodies that show you have Hashimoto's thyroiditis, but you probably still have Hashimoto's. So for what it's worth, a lot of people do come back positive. So also you should get a CBC, which is a complete blood count to check for anemia, a BMP, a basic metabolic profile, to check your kidney function and check your electrolytes. Sometimes we'll see lower sodium levels or salt levels. Lipid panel, which is checking your cholesterol, because that high cholesterol and low thyroid function tend to go hand in hand. In really, really, really bad cases where like you're super sluggish and we're worried you're really not functioning, we would check a creatine kinase. That's a muscle breakdown product. Again, that's not as common, but wanted to throw it out there. And then sometimes we check prolactin levels. Prolactin also comes from the pituitary gland in the brain, and sometimes you can have like a weird pituitary tumor causing your thyroid to not be right, and so sometimes it'll check a prolactin level with that. These last two are a bit more rare. All right, treatment, conventional medicine. If you have hypothyroidism or you had Hashimoto's thyroiditis and have finally burned your thyroid out, essentially, where you're not making any more hormones, you get a prescription. Lucky you. There's Synthroid, levothyroxine, or Levoxyl. They are very similar. They are a synthetic form of T4. Again, not the most active version. You tend to want to stay on whatever you're on. Switching from brand name to generic versions can change your thyroid levels. Thyroid hormones, your T4 in particular, needs to be checked every 6 weeks when you have a change in medication dose. So if you've started on it, it needs to be rechecked in 6 weeks. It can take up to 6 weeks to see changes in thyroid hormone levels. So the other one is Cytomel. That is T3. That's one that typically just the endocrinologist is going to prescribe, and that's if you don't convert well from T4 to T3. It is really finicky. It is just not a very reliable in your bloodstream type of drug. It's usually dosed twice a day. You absolutely have to be in the care of a specialist if you're on that one. So there are more natural options. Not every doctor will write for them. If you can find an integrative medicine healthcare provider, they're usually much more open to these. They are Nature Thyroid, Armor Thyroid, and WP Thyroid, sometimes also called West Thyroid. Those can be harder to find, but the last two, WP Thyroid and West Thyroid, are hypoallergenic. So if you tend to have a lot of reactions to stuff, it's a safer thing. But there can be nationwide shortages of those more so. So these are desiccated porcine thyroid hormone, which means it's dried pork thyroid hormone. But the cool part is it has T1, T2, T3, T4, and thyroglobulin in it. So you get this bonus of having all these different things. Typically, it's best to take your thyroid hormone first thing in the morning and to chew it. It will get in your system a little bit faster, and you ought to take it about 30 minutes before you eat. So that tends to help people feel better. Sometimes people with Hashimoto's thyroiditis need to be careful because of the thyroglobulin in here, because your body has made those antibodies to thyroglobulin and it's attacking it. But in my practice, it's been rare to see that affect somebody. Just want to throw it out there. So, things that you can do naturally to support your thyroid hormone. What if these things come back mostly okay, but you still don't feel great, don't feel optimal, or you're the lower end of normal? Every healthcare provider has their own preference for kind of like what people feel better, but usually the bottom half of the hormones levels, you tend to not feel as great. So bumping them up a little bit or supporting them can be helpful. If you have thyroid antibodies, if you have Hashimoto's, gluten is not your friend. It is pro-inflammatory and it will increase those antibodies. Sorry, just you and gluten are not friends. Dairy can be a problem as well. Some people can tolerate some of that A2 milk proteins seen in like raw cow's milk from certain cows, or found in goat's milk and cheese. If you are really trying to get rid of thyroid antibodies, I would hold off completely until your labs come back that your antibodies have disappeared. Selenium is very helpful. DMSO cream, compounded cream applied to the thyroid has been awesome. DMSO is a precursor to glutathione. Glutathione is an antioxidant that we don't absorb well in pill form because our stomach acid just destroys it. We can get it from fresh fruits and vegetables, lots of other great things. Check the show notes. I got a big list of stuff. But DMSO cream applied right where you need it is a fantastic way to bump those glutathione levels and start healing your thyroid, cooling down that inflammation, cooling down that autoimmune craziness. So vitamin D, there is a strong link in several different medical articles in PubMed about low vitamin D levels and hypothyroidism. So vitamin D supplementation can be huge. L-tyrosine. Tyrosine helps T4 to become iodinated. It attaches that iodine on there and helps make it more effective, more active. So tyrosine can be very helpful for that. So using iodinated salt, like we talked about, I use table salt usually when I bake just to make sure I'm getting some iodine into my system. Be very careful about over supplementing iodine. If you want to use an iodine supplement, like iodine supplement, Lugol solution, something like that, you should be in the care of a provider. You need somebody to keep an eye on you, because I have heard horror stories from women who have taken their thyroid health into their own hands and used too much iodine supplementation and gone the direction of hyperthyroidism. So don't do that. Please don't do that. Be careful. Taking kelp can be helpful. Eating sushi, like those sort of seaweed, including those sort of things in your diet can be great. But please, please, please be careful about that. So zinc and T3 levels, that active thyroid hormone, have been positively correlated, meaning higher levels of zinc, higher levels of T3. Woo woo, fitting in your skinny jeans. So magnesium is also very helpful for solid, great thyroid health and healing up your leaky gut, working on your adrenals. The good thing is the foods that help the one also help the other. And it's probably not just one thing making you feel the way you do now. It is most likely not just your thyroid. I have never seen anybody walk into my office with Hashimoto's thyroiditis and that's the only thing going on. There's always some abnormality in their cortisol levels, meaning their adrenals and their HPA axis are a bit off. And there's always some element of leaky gut and food allergies. Sorry about that, but I just want you to know so you can get better. Working on all these things together synergistically helps. In light of that, I've got to talk about heavy metals. I'm sorry. There are a lot of environmental toxins we come in to contact with these days, and one integrative medicine doctor I read said that he always found heavy metal toxicity in patients who had Hashimoto's. I would not say that has been the case in my clinical experience, but it's probably worth checking, and it is definitely worth making the better choices. Organic foods, organic cleaners, being careful to have clean water to drink, living in a house that is good for you, not like moldy and gross, and those sort of things. Making the best choices you can. So just have to throw that out there because that can have such an effect on so many of us. So foods to not eat would be your raw brassica vegetables. So broccoli, cauliflower, kale, Brussels sprouts, all those things, eat them steamed. It breaks down some of the chemicals inside that can interfere with thyroid peroxidase action. Remember, thyroid peroxidase converts T4, less active hormone, to T3, more active hormone. So you will feel better. And then functional foods, foods that you can eat that will actually help your thyroid. Complex carbohydrates. Yay! So we're not talking the white stuff. No white flour, white sugar, white rice, white potatoes. I wouldn't like throw brown sugar in there either. And always eat them with protein to blunt your blood sugar spike that you would have after eating them, including some complex carbohydrates in your diet is huge. It will decrease that reverse T3 level, that converting that T4 into reverse T3 because you're not using it right. So it helps. It also helps to soothe your adrenals. Check out the adrenal lecture. It's so good for you to have some complex carbs in your diet. Not all the time. You don't even have to have them every day, but 5 to 7 times a week, you ought to be eating some complex carbohydrates. So I personally eat them every day because I love them and because I have had HPA axis dysregulation or adrenal fatigue and as my primary thing, and then leaky gut on top of that. And thankfully my thyroid did not get affected, but it is important to nourish your whole body and get all of you feeling great. So omega-3s, you like eating fish, fish oil supplementation, things that are high in alpha lipoic acid, which would be sprouted seeds like hemp, flaxseed, chia seeds, all of those can help a ton. ALA is also, alpha lipoic acid is great for weight loss, yay! So it can mimic caloric restriction without actually having to cut calories, yay! So seaweed for the iodine, which I know we've mentioned, coconut oil to decrease the inflammation and heal up your gut too. Clean water, as I mentioned, less toxins, and fresh fruits and vegetables for those glutathione levels. So there you go. That's how to have a happy thyroid. Lots more links in the post for other things that you can do and a little more in-depth on some of these things. Thanks so much for joining us for part 4 of my Insider's Guide to Holistic Health. Hope you're having a great day. Bye.